At the University of Texas Health Science Center at Houston, we believe in data to inform healthcare and policy decisions. We also believe that a trusted source of data is critical to improve the health of all Texans. That is why the Center for Healthcare Data, part of UT Health, was formed and has created the Health of Texas, a free, publicly accessible website with data on many aspects of health among all Texans.
I'm Dr. Trudy Millard-Krause.
And I'm Dr. Cecilia Ganduglia.
Together, we are co-directors of the Center for Healthcare Data. This website was conceived by a work group of experts from around the state to help the public learn more about how health varies across our state.
I applaud the effort of the Center for Healthcare Data to develop the Health of Texas database. During my 12 years in the Texas House of Representatives, and particularly the last 4 when I served as chairman of the Appropriations Committee, it was a continuing challenge to get the most current, complete, and accurate data on healthcare delivery in our state. There really was no place to go to see the patterns of care across the major public and private payers of care. This type of information is critical to policymakers who have to decide how best to allocate the state's limited financial resources.
It is a vital tool that can be used by policymakers, researchers, the general public, and medical professionals working to improve the lives of Texans.
Knowing what is going on as it relates to the health of a community, the health of a state, is critically important. So the Health of Texas website is important to me in my role at the American Heart Association right now, because I can see health status information, socioeconomic information that helps me better understand what needs to get done to do better, and or over time, what things have been done that have made a difference.
And it can make all the difference.
As a practicing physician and a chief medical officer, every decision I made was shaped by the experience of our patients individually and collectively.
The Health of Texas website helps us as physicians to see the forest for the trees. We're taking care of individual patients, but ultimately that adds up to the bigger picture of what health is in our communities and across the state. It also gives us perspectives on issues like social determinants of health, which, as we know, are as important, if not more important, than the healthcare delivery that we're providing patients. And it helps us put into context the challenges that our individual patients have as they go about their daily lives.
The Health of Texas allows users to explore health outcomes by geography, age, gender, and payer, which benefits physicians and other providers at every level.
Our mission is to help people live healthier lives and help make the healthcare system easier for everyone. It's an opportunity for all parties in the healthcare ecosystem to have access to reliable and actionable data that will hopefully help us to remove waste in the system and help drive down cost and improve the quality of care provided.
In a year like 2020, we've seen the value a site like the Health of Texas can provide.
The COVID-19 pandemic has made it very clear to all of us that having access to timely and accurate information on illness within our communities and the healthcare system's capacity to deal with cases that are requiring hospitalization and sometimes intensive care is very, very important. The truth is that even when we're not facing a public health emergency, these same principles apply. We've made tremendous progress in reducing deaths from heart disease and stroke over the last few decades, but we can do better. As we work to enhance our future prevention efforts, we will look constantly at data and sources such as the Health of Texas website to monitor our progress and determine what more needs to be done.
This is just one example of the many ways that the Center for Healthcare Data is serving Texas. They are gathering information from our state health insurance plans to identify opportunities to improve the quality of care and control costs. They are also helping to evaluate the insurance companies who coordinate care to our Medicaid population. As the saying goes, all healthcare is local, and this database shines a bright light on the regional difference in healthcare across Texas.
We look forward to continuing to expand the Health of Texas website for the benefit of the residents of Texas.